So I'm going to take you to my research study titled Outcomes of Ultrasound Scan Diagnosis Fetal. I'm going to take you through the introduction and background, then methodology, results and discussion, and finally conclusion.
You can proceed.
Sorry for that. So incidence of Olygohydramnios ranges from about 1 to 5%, and that is according to a study that was done in India. And Olygohydramnios is associated with poor maternal and fetal or neonatal outcomes, often arise from cord compression, meconium aspiration, and uteroplacental infections. So according to Mesa and friends in a study done in 2012, preeclampsia was present in 24.7% cases with Olygohydramnios. And in 2020, a study was done by in Zimbabwe on 2,718 pregnant women, and 26% of them with preeclampsia. But the study doesn't address the association between preeclampsia and Olygohydramnios. So in our local setting, the quantity of ultrasound scan diagnosis of Olygohydramnios, despite poor perinatal maternal outcomes that are associated with Olygohydramnios. So on the main objective was to describe outcomes of ultrasound scan diagnosed of Olygohydramnios at Darare fetal males from 36 to 42 weeks gestation. On the sub-objectives, to determine the incidence of ultrasound scan diagnosed Olygohydramnios from 36 to 42 weeks gestation, to determine the association between preeclampsia and Olygohydramnios in pregnancies of 36 to 42 weeks gestation, and to describe future outcomes of Olygohydramnios in pregnancies of 36 to 42 weeks gestation. So on the methodology, that was a retrospective analytical cross-sectional study. The setting was two central hospitals, which are Mugabe and perinatal group of hospitals. Target population were pregnant women between 36 to 42 weeks gestation. It had been diagnosed with Olygohydramnios through ultrasound scan. Target population meeting the exclusion criteria, and the inclusion criteria, pregnant women who had Olygohydramnios at gestation age of 36 to 42 weeks. And the exclusion criteria, multiple pregnancies were excluded, understandably, because multiple pregnancies, especially twins and almost all iota multiple pregnancies, are delivered prematurely. On the sampling method was convenience sampling, and the sample size was 44.
I think I lost you. Am I the only one who doesn't see his screen?
No, I think it's lost connection.
Let's give him some few minutes.
Sorry, we're just having network problem, but then we are resolving it.
Okay, sorry, can you hear me now?
Yes, we can hear you.
Okay, thank you. So on the result, the incidence.
But we can't see your screen. I can hear you, but I'm not seeing your screen.
Okay. Okay, so on the results, can you hear me now?
Yes, we can hear you clearly.
Okay, fine. So the incidence of oligodramnus was found to be 1%, which is against some studies which were done. So on the demographic data, starting with parity, 61% of these pregnant women were primigravida, and 39% were multigravida. And on gestational age at which these pregnant women delivered, 25% of them delivered at 38 weeks, and only 5% delivered at 42 weeks. So on the conditions associated with pregnancy, on the distribution of the association, on the distribution of the conditions associated with pregnancy, chart shows that unassociated or isolated cases of pregnancy. Okay. On the distribution of conditions associated with Ultrasound, the pie chart shows that unassociated or isolated cases of Ultrasound takes lion's share at 50%. In conditions in which Olygohydramnios was associated, preeclampsia is at the top at 16%, followed by PIH at 14%, and by post-death and PIH at 7%. And post-death in preeclampsia, as well as chronic hypertension, where it's at 2%. So on the indication, 43% of these pregnant women delivered Ultrasound itself, then followed by preeclampsia, which was 20%, because although all the patients had Olygohydramnios itself was not only cater for delivery. So from this, we can see that Olygohydramnios is followed by preeclampsia is 20%, and meconium aspiration and umbilical cord compression were delivered at 2.27%. So on the mode of delivery, in some of the Olygohydramnios cases, some agents medical intervention, and on this pie chart, we can see that most of these pregnant women delivered through cesarean section at 48%, followed by normal vaginal delivery at 27%, and lastly, induction at 25%. So on the ABGAS score of babies, 50% of them had an abnormal ABGAS score, and 48% had normal ABGAS score. So on the distribution of weight among the born babies, we can see that basing on the Wu chart, most of the babies were appropriate for gestational age, except at 38 weeks, where we can see that 64% of them were small for gestational age, and 36 were appropriate for gestational age. None of them were large for gestational age. And I think from the demographic data, we saw that most of these pregnant women delivered. So on a positive note, all of the babies were born alive. So on the another objective, finding the association between preeclampsia and oligodramnios, there was a significant association between preeclampsia and oligodramnios. And when we further narrows down to find the ABGA score on these pregnant women who had oligodramnios and also had preeclampsia only, ABGA score was abnormal for about 7% of the, and only 43% had normal ABGA score. And on weight distribution, about 86% were small for gestational age, and only about 14% were appropriate for gestational age. So on the participants that were referred to the neonatal intensive care units and nursery, only 2 of them were referred to the NEPO, and these pregnant mothers had preeclampsia. And also only 2 were referred to the nursery. These pregnant mothers had delivered through cesarean sections. They need some sort of covering. So the conclusions and recommendations, the study showed that there's a significant association between preeclampsia and oligodramnios. And also the study shows that cesarean section is the dominant mode of delivery in women with oligodramnios. The study suggests that ABGA score is generally low, it is generally appropriate for gestational age. So the recommendation is that a follow-up study with a large sample size is recommended.